Hello and welcome to my presentation for metal bonding porcelain aesthetic challenges. I hope you enjoy it. There is no more rewarding experience in dental technology than to construct a porcelain crown that matches exactly the color, the form and the translucency of the patient tooth to the perfection. These results can only truly be accomplished by a good teamwork and a good information. Metal bonded porcelain is a technique that has been used for years, and its main characteristic would be in its strength, but its main disadvantage is the space needed to create the perfect natural crown. It all starts at the dentist. For a technician, a pre-op model is a really useful tool. It gives you a chance to see what the patient had before. Once the prepping has been carried out, this information gone. Study cast and diagnostic wax-up are really important when it comes to multiple anterior restoration. It gives the help the dentist when it comes to prep, help technician what can truly accomplish, and help the patient they can see an idea of the finished results. Other benefits are that temporary can be made from diagnostic. Dentists can add or take a material away. Impression can be made and the technician will make the restoration exactly the same as the finished temporary in shape. When the finished job done, it should be perfect and no trimming of the porcelain should be needed, keeping the overall porcelain aesthetics. Metal is a silver color and can look black in the mouth. This therefore has to be masked out. This is done applying opaque, a very dense in color paint-like substance. 2 layers are applied. Consideration also has to be taken into account when dealing with bridge work, especially connectors. They have to be placed in the correct place, not too far forward, high or low, as the teeth will not have good separation and it will look blocked or false. The technician is trying to create an illusion that they are all individual teeth. Maryland bridges are also very popular as often no preparation is required. This is a good technique, but care must be taken when finishing the wing, as it must be hidden and trimmed, so it cannot be seen. Also, if the patient has translucent teeth, the wing can shine through and give a grey look at the incisal of the tooth. And this is the picture when we actually applying opaque on our coping. It has to be in 2 layers, give an even layer on our coping. When metal bonded crowns are prepared, they are subgingival and the gum covers the restoration and it looks fine. But at later stage in a patient's life, gum could shrink away, can display the metal edges and doesn't look nice. This is due to the fact that the porcelain can be very thin in these areas and can appear grey or opaque. If the prep has been trimmed with the shoulder, then this problem can be eliminated or minimized by the application of shoulder porcelain. First, the metal work is trimmed back from the edge of the margin to allow room for the porcelain shoulder to be applied. This is very opposious colored porcelain, and same have cervical colors to match in with a natural tooth. The benefit of a porcelain shoulder is the marginal edge is now porcelain, tooth colored, and not metal. It looks more natural, less grey or opaque color, as there is more depth to the porcelain. Information is important when it comes to porcelain design. The more information written on the lab sheet is the better. Photos are also often used, or the patient may even come to the laboratory and the technician can do own shade take and make notes, photos, or even build up the crown till the patient's there waiting. We want to create the illusion of depth in our crowns, otherwise they look flat in a shape and false in color. The way in which the porcelain is laid down will affect the overall look of the crown, so the correct technique must be used. The use of concentrated colors and stains inlaid into the enamel porcelain can transform an artificial crown into one that immediately blends in with the patient's natural dentition. Sometimes the challenges we have can be to make a crown look wider, narrower, longer or shorter than they actually are. This can be achieved at the trimming porcelain stage. This is done with the line angles. We want your eye to look at one thing more than the other, and this can work really well as a lot of time in life you see what you want to see and your brain changes it for you automatically. And this picture is in two tables, but they are actually the same measurement in width and length, but they look different. And this is a good example of an illusion for you.